Excessive sweating, which is the disease of people who sweat drop by drop from their armpits, face and hands, even in cold weather, in winter is called hyperhidrosis in medicine. Sweating is a normal physiological state. However, hyperhidrosis, which is called a disease, is the excessive sweating of the person without increasing body temperature out of physiological needs. Excessive sweating can be seen secondary to some conditions in the body, such as infectious diseases, diabetes, hyperthyroidism, heart diseases, menopause, obesity, and some drugs. Primary hyperhidrosis, on the other hand, is the overactivity of the sweat glands without any other underlying disease. Exact cause is unknown. It may increase due to stress, but the cause is not a psychiatric disorder. Although excessive sweating can be seen in any part of the body, it affects some parts locally. These include the phrase armpits and hands. Studies have shown that excessive sweating restricts one's daily social activities, causes a decrease in relation with other people, is embarrassed when shaking hands, has some problems in typing or using the keyboard, affects education life, creates a lack of self-confidence, causes shyness, and can reduce the quality of life. Another situation is the smell created by bacteria in the sweating area. Non-surgical methods of treatment include antiperspirants, chemicals, iontophoresis, and Botox treatment. Unfortunately, the success achieved with these methods are temporary. In addition, we can reduce sweat by using some drugs, whose doses should be adjusted carefully. The system that controls the activity of sweat glands in the body is the sympathetic nervous system, a part of the autonomic nervous system that cannot be controlled by the person. The procedure to reduce the activity of the nerves related to the sweat glands is called sympathectomy. At the point where scientific studies on excessive sweating has come, the reliability of success of the surgery called thoracoscopic sympathectomy, which is performed using today's high technology with thin diameter telescopes and cameras, and in which the activity of the sympathetic nerves is surgically removed, has been demonstrated. The operation is performed with a small incision in the armpit and is completed without intubation and without placing any drains. It is cosmetically satisfactory and the risks are minimized in terms of general anesthesia as there is no intubation. After the procedure, 1 night of hospitalization is usually made. In appropriate cases, discharge can also be made in the evening of the same day. Although this disease is not considered by many people, our experience and observations show that excessive sweating negatively affects the social life and education of the person when it is not treated. For this reason, we recommend our patients and their relatives to start treatments as early as possible.